Good evening, everyone, and welcome to this evening's webinar on Keeping Your Relationship Alive, the Physical and Emotional Aspects of Intimacy in MS. My name is Ann Lee, and I'm the Senior Specialist of Programs and Online Education for CAN-DO Multiple Sclerosis, and I'll be your moderator this evening. Most of you, I think, already know who we are, but if you don't, CAN-DO MS provides lifestyle empowerment programs for people who are living with MS and for their support partners. We help to empower people to move beyond their MS by giving them knowledge and tools and confidence to adopt healthy lifestyle behaviors and to actively co-manage their disease and live their best lives. And so some of the programs that we provide to help you and your support partners to live these best lives are our webinars that you are now participating in now. They occur monthly, and all of our webinars are recorded and housed online, and they're archived on our website. You can see our web addresses here online on your computer screen. And then we also have 3 in-person programs. Our flagship program is our 4.5-day CAN-DO program that's once a year. And then we have our Jumpstart programs, which is our 1-day program that's done around the country about 5 to 6 times a year. And then we also have our 2.5-day Take Charge program that's done twice a year. So if you visit our website at any of these web addresses, then you can find out more information and more information on how to register for these programs. And you can also connect with us through social media. We are on Facebook, so you can find us on Facebook, like us, and you'll be able to get all kinds of up-to-date information about our upcoming events and programs. And you can also find some cool pictures from our events and programs as well. You can also find us on Twitter, and you can find us on YouTube. We have a lot of our videos and recorded webinars also housed on YouTube, so please be sure to look for us there. And so just a few housekeeping issues to go over before we start the webinar. We'll save about 10 to 15 minutes at the end of the program for your questions and answers. If you do have a question, you can post them in the chat feature, which is located on the left-hand bottom of your computer screen. All of your lines are muted because this webinar is recorded, so you can chat in your questions through the chat feature, send them to me, and you can chat them throughout the entire program, and we'll save them and try to get to as many as we can at the end of the program. And again, so this program is being recorded and is being archived, so if you need to get off the webinar at any point, that's no problem. You can find us again on our website tomorrow afternoon and hear the entire webinar in its entirety. So now I would like to introduce our speakers for this evening's webinar. Pat Kennedy, who is our resident nurse here at CAN-DO MS, has been working in the field of multiple sclerosis since 1987. Initially, she worked as a nurse practitioner in a large comprehensive MS center, and she now works for CAN-DO Multiple Sclerosis as a nurse educator for staff and community and a program advisor for the organization. She sits on the Client Education Committee of the National MS Society, and Pat is also president of the board of the International Organization of MS Nurses and is certified as a multiple sclerosis nurse. She serves on the editorial board for the International Journal of MS Care, and she has had the opportunity to speak about MS to people living with MS as well as professional audiences internationally and contributes to many publications and books. She is the editor of a new book written by a multidisciplinary team of professionals who work as staff for CAN-DO MS. The book is entitled The CAN-DO Multiple Sclerosis Guide to Lifestyle Empowerment, published by Demos Medical Publishing. And our next presenter is Roz Kalb. And Roz Kalb is Vice President of Clinical Care at the National Multiple Sclerosis Society, where she develops and provides educational materials, clinical tools, and consultation services for healthcare professionals. As a clinical psychologist in private practice, Roz provided individual, group, and family therapy for people living with MS for more than 25 years. She is the author of the National MS Society's Knowledge is Power series for individuals newly diagnosed with MS. She's the senior author of Multiple Sclerosis for Dummies and co-author with her husband, Nicholas LaRocca, of Multiple Sclerosis, Understanding the Cognitive Challenges. Roz is also the editor of 2 books, Multiple Sclerosis, The Questions You Have, The Answers You Need, now in its 5th edition, and also Multiple Sclerosis, A Guide for Families, as well as a proud contributor to the Can Do MS Guide to Lifestyle Empowerment, published by Demos Health. So we're really excited to have Pat and Roz on this webinar, and I think you'll really enjoy this program. So now I'd like to welcome Pat Kennedy.
Thank you so much, and good evening, everyone. We're so happy you could join us tonight. This is our Valentine's Day special webinar on keeping your relationship alive, the physical and emotional aspects of intimacy in MS. And we like to do this around this time of year and just feel it's a particularly big topic that people like to hear about at any time of the year, but it works well now. I am, as Ann said, Pat Kennedy, nurse educator for Can Do MS. I'm honored and excited to have the privilege to have a conversation with all of you and with Dr. Roz Kalb about this very important topic.
And I'm Roz Kalb, and I am equally excited to be here with all of you tonight and to present with my friend and colleague, Pat Kennedy. I do work at the National MS Society, but I am also a proud staff member at Can Do MS programs around the country, and I hope I will get to meet some of you at some point along the way. We're happy to be here.
And we're happy to have all of you here, and we know that in our audience tonight we have both people who live with MS as well as their support partners. And it's for conversation's sake, it's always good to have both halves of the equation here. So this topic is geared for everyone who is affected by MS. So I'm going to start the program off by talking about what intimacy is. And I think all of us have an idea in our minds of what intimacy is, and it could be any number of things, but it really is a very complex topic. And so I just want to mention the sorts of pieces that go into what makes intimacy. Intimacy really at its root means closeness with one another. And intimacies can certainly be in a personal relationship. It can be in a family. It can be with your best friend. It can be with any number of different people in your life. But it means that closeness. It also means that in this relationship there is trust. There is also respect for each other, so that when you're talking, when you're sharing, the other person is listening, and you know that you can say what you need to say and can trust that that person is going to hear it and not be in a negative place. Intimacy also means that there is mutual concern. And so the two people involved in this relationship are concerned about the other, and that opens the door to be able to share. It also means giving as well as receiving. So you don't have intimacy that is one-sided. Intimacy occurs when both people are engaging in that closeness together. It also means honesty, that when people talk with one another, they're not afraid to share what's on their mind, what's in their hearts, and they're able to be honest and feel safe in that honesty. And it does also mean that physical and emotional connection. Intimacy, though, is more than sex, as I've just gone through a list of the things that it does involve. And intimacy in relationships can include many other aspects, and we're going to be going over those aspects. But just know that intimacy is that glue that holds relationships together, but it doesn't happen in a vacuum. So when you're living with MS, either as a person with MS or the support partner, just know that MS itself can interfere with intimacy. And I'm going to kind of just list for you the areas that in fact are areas that can interfere with intimacy. And one of those areas is stress and other emotional issues. changes in roles as MS is present in families and in relationships. Sometimes people are doing different things than what they had done before. There are communication challenges between support system members and also communication with healthcare providers. Disease changes in the central nervous system can interfere with intimacy. Symptoms of MS can interfere, and side effects from some of the medications that we use in treating MS and other diseases can also affect that intimacy. So, Roz, can you begin by telling us a bit about how stresses and strains can affect intimacy?
Sure, I would be happy to. So I think I don't have to tell anybody here that MS can be a challenging disease for everyone in the family. And there are various ways that those challenges can put a strain on relationships. First and foremost, I think that couples who are living with MS may just feel drained sometimes, drained by the disease and by the effort it takes to manage the disease in their lives, manage the symptoms. So it can become such a preoccupation that it doesn't leave a lot of time and energy for focusing on other aspects of your relationship. Also, there are a lot of feelings and fears that both members of a couple can experience when they're living with a chronic illness like MS. It's not unusual for sadness or anger, anxiety, sometimes even guilt to take over and get in the way of communicating with one another. People don't like to upset their partners. They don't like to upset people they love by talking about difficult feelings or talking about challenging issues. And so sometimes those feelings and fears get in the way of the closeness that Pat's been describing. And Pat has mentioned the role changes that can interfere as well. You know, if someone living with MS has difficulty doing some of the things that he or she used to do as part of their part in the relationship, in the partnership, there's a shift in roles. And sometimes those shifts in roles can lead to a change in the balance in the partnership. So the partnership doesn't feel familiar anymore. It doesn't feel the way it used to feel. And those changes can be difficult to talk about and create an emotional distance that gets in the way of people sharing intimacy. For all of these same reasons, communication can be challenged. If you're feeling so drained and tired, or you're feeling overwhelmed by uncomfortable feelings, or you're feeling some resentments or anxieties about the way that your roles have changed in your partnership, it may simply be difficult to start conversations. And when you stop communicating with each other in an effective way, that's one of the major obstacles to staying close, to feeling connected with one another. So we're actually going to talk a lot tonight about communication and how that can be a helpful strategy for enhancing intimacy and maintaining intimacy in your relationship. In addition to all of these stresses and strains, I think that there are other ways that MS can directly affect intimacy. And so I'm going to ask Pat if you can tell us some of the other ways that MS can interfere with intimacy.
Yes, and I inferred some of these just a few minutes ago, but MS, the disease of MS and the lesions that occur from MS can have an impact as well as medications and other MS symptoms. And having so said, does that mean that that's all there is? And of course the answer there is no. We need to know what kinds of problems that you might be experiencing before we on the healthcare side are able to do anything about helping to correct that. So we really recommend, above all, that when there are difficulties in intimacy between you, when you're experiencing physical changes that are interfering with your ability to respond as you'd like to, that you begin to open that conversation. And you need to open that conversation with your partner and also with your healthcare provider. Because if that door isn't opened and if that conversation isn't started, then the solutions will not be reached. So, Roz, did you have something to add to that?
Well, I'm going to just remind everybody that this is a very complex topic, and so we're not going to be able to deal with all aspects of it in tonight's call. But I'm going to ask again if Pat would want to discuss some of the most common issues and highlight what you need to know about the ways in which MS can affect you physically, as well as the symptoms of MS and the medications that you use.
So the central nervous system, and there's a small graphic for you to see on your screen. The central nervous system, as you know, is fully involved in your ability to respond in a sexual manner, and depending on where those lesions are located, will dictate exactly what changes might occur for you. So you all are aware that lesions can occur anywhere, so therefore the symptoms you experience may be varied and all over the place. But we call those kinds of symptoms related to the lesions primary changes. So what kinds of things are in that primary realm? Well, one of them, a very important one, is that people explain that they have changes in their sexual drive or their desire. And that is huge. In a relationship, it's a very personal affront, and you miss that. That's one of those things that you begin to grieve if it was there and now it isn't. Bear in mind, though, that people who don't have MS may also have these kinds of changes as well. So we can't just lump everything and say this is all due to MS, but it certainly can be due to MS, and again, this is one of those things that needs to be talked about. This isn't something that you just sort of shove inside. Some people report that they have a decreased sexual arousal. Things have definitely changed for them from how they used to be to how they are now. And that, again, can be one of the primary symptoms of the disease itself, or it can be due to perhaps symptoms of MS, such as fatigue, that may interfere with your ability to sort of get aroused. And other relationship issues can interfere with that as well. So we think a lot of it is due directly to MS, but we also know that a lot can be due to other factors. And again, that communication is going to be so very important. Some people explain that they have difficulty reaching orgasm. Not that they can't necessarily, but it may take them a very long time. And in some cases they can't after all is said and done. And this definitely can be a primary change, and also, like everything else, it could be related to other things as well. And unfortunately what happens in relationships is when one person is struggling with that, then a lot of thoughts are going on in both persons' heads. Why is this, and what am I not doing right, and that sort of thing. So it's an important finding that people need to discuss with their partner. We definitely hear that erectile dysfunction is a problem for men living with MS. It, of course, is a problem for men for other reasons as well. So that does need to get checked out. Is this, in fact, an MS issue, or is this something that is related to another blood flow problem or some other illness? Now, there is treatment for this, and it is fairly effective in men living with MS who have erectile dysfunction related to MS. And women complain of decreased vaginal lubrication. And this is actually the female manifestation of arousal. And so if things are pretty dry and pretty uncomfortable, it makes people not feel so good about that closeness and that relationship. And so once again, it needs to be talked about. So these are just a few of the things that can be affected by MS, but they are certainly some that I want you to keep in mind so that when you're going to sit down and have conversations, you can be able to talk about them and know, okay, this may be an issue, let's have a discussion. There is in the back of this slide deck, there is a list of resources from the National MS Society that recommend some brochures that are going to be helpful in helping you manage some of these symptoms.
So Pat, thanks so much for describing these primary changes in MS. You mentioned fatigue as something that can also affect sexual arousal and sexual feelings. Are there other symptoms of MS that can contribute to some problems that people might be experiencing?
Absolutely, and I mentioned fatigue, of course, but fatigue is also the sort of number one symptom that most of you with MS experience, and depending on your lifestyle and how many things are on your plate, fatigue really gets in the way of many pleasurable activities, and it's something that needs to be looked at, needs to be managed, and people learn to do things like pacing themselves. So it isn't that it's a problem that can't be solved, but it is a problem that has to be thought about and needs to be planned around. Spasticity can be something else, stiffness. When you're stiff, when you have spasticity, you're uncomfortable, and it's hard to get into comfortable positions, and sometimes it just seems like it's more work than it's worth, and so people sort of turn off the mood because of that discomfort and not being able to relax and enjoy the moment. Pain, if you've ever had pain from other causes, as you know, pain is a big turnoff. And if you're experiencing pain from your MS as a symptom of your MS, it can definitely dampen the mood. And when you experience that pain, you're not going to be able to relax for that either. And so again, when you're making your list for your physician, and when you're talking to your partner, you want to bring up these very specific symptoms. People do describe problems with bladder and bowel issues. And I think that roughly 80% of people with MS have intermittent issues with bladder, and bowel is very common as well. And this is always kind of in the back of people's minds, and it makes it difficult for people to relax and be in the moment. So bladder and bowel problems are manageable, but they need to be discussed. Depression. And depression from any cause, certainly from MS, but depression for many other reasons as well. One of the biggest side effects of depression is that people lose their interest in sexual activity. So if there is depression in you or even in your support partner, if you're living with MS, it can be a cause of depression. And this needs to be managed as well, and it may help if you have this discussion both with your partner as well as with your healthcare provider. Cognitive changes can interfere in any relationship, and in that relationship it may cause problems with sexual functioning as well. And when there are sensation changes, and sensation goes anywhere from one end where it's numb, other end where it's painful, and so it's in that whole continuum. And if you're experiencing sensation changes, things may not feel the same to you, and you'll need to talk about that so that the person you're with understands.
So Pat, it's really interesting to see how many different aspects of life with MS can affect sexual function. And I think we all know that sexual function is a fairly complex thing in our lives, even without the complications of MS. So I'm glad to hear you encouraging people to share this information with their healthcare provider. And before we go on, I just want to tell one story that I think illustrates how important this is. We had a physician who was asked to give a lecture about sexuality to a group of people with MS, and he went through all his slides and he presented lots of good information. And a woman in the audience raised her hand and asked him how often he talked to his patients about sexual function. And he thought about that a minute, and he said, well, I'm always happy to answer questions whenever anybody asks them. And so she followed up with a next question, which was, how often have you been asked? And he said, never. So, it was sort of a conspiracy of silence. Healthcare professionals don't always bring up the subject, and they don't always ask. So if you don't bring up this very important topic with your healthcare provider, you may be living with a lot more challenges and complications than you need to. So I think Pat and I would both encourage you to not be shy and to make sure to share any of these questions. So in addition to all these symptoms that can affect sexual function, Pat, are there other things that people need to be aware of that can affect their sexual function?
And this is the part that often you just don't think that this is all part of it, but it certainly can be. The medications that you take can affect sexual function, and that's medications you may take for MS, or that may be medications you take for other illnesses that you may experience. But antidepressants, it's a side effect that is commonly reported with most of the antidepressants. Some of the antispasticity medications can have an effect on a person's ability to respond sexually. Anticholinergics, and those are the class of drugs primarily that we use to treat bladder issues. And so if you're on a drug for bladder problems that you may be experiencing, it may interfere with your ability to respond, and just be aware of that. So again, you can talk to your physician who prescribes these, your healthcare provider, and see if there's something else that you might want to use instead. And then other medications that you would be taking for other health issues. So they're all connected because everything is connected to everything else. And so if you're having these difficulties, you don't have to sit back and suffer without at least asking the question. So be the first in your practice, right, to ask that question of your physician. So Roz, I'm wondering now if couples come to you and they're expressing that they're having changes in their partnership that are impacting their feelings of intimacy, what do you suggest to them? What do you tell them to do or look into?
Well, I don't think people listening to this will be surprised to hear me say that first, congratulate them and thank them for bringing up the issue and coming in to talk about it, because that's the most important first step. If people can begin to share with each other their concerns, any changes they're experiencing in their feelings or their roles, or even in their sexual function, and they can share those things with each other, that's the first step to finding solutions for whatever the problem is. When people have difficulty starting those conversations, and it certainly isn't easy, and it doesn't come naturally to a lot of people to talk about feelings and problems, then I encourage them to think about talking to a counselor, because sometimes it helps to have a third party, an objective person, just to jumpstart that conversation. Some of these things that need to be talked about, people aren't used to even talking about out loud at all. They just don't have the vocabulary to do it. And so having a counselor to start that conversation can be really helpful. And as you've said, Pat, and I've mentioned in my little anecdote, you certainly need to bring in your healthcare provider to get the help with you that you need to manage the problems. I think the other thing that's really key, and this is a message that the Can Do team gives in relation to all kinds of challenges people face when they have a disabling illness, and that's to be open to doing things differently. If you're willing to try different strategies or tools or positions, if we're talking about sexual function, being open to those changes is what makes it possible to adapt to whatever is going on with your MS that's causing a problem. So we do encourage people to think creatively and be willing to experiment and try and then share feelings with each other about how those changes feel.
And Roz and I are guilty of, we've worked together a very long time, and we talk a lot about communication, and we've had people actually say to us, well, you talk about it all the time, but how do you do it? How do you communicate? And so, Roz, can you give us some tips about how to talk with your partner?
Sure. I think, it starts by being aware of all the different ways that we communicate all the time with one another. It's not just about having conversations. We do communicate with our words, but we also communicate very significant messages with the tone of voice we use. Sarcasm goes a long way towards conveying how you feel, or an angry voice, or a loving voice. Those tones express as much as the words we're saying. The look on our face, if we look angry, frustrated, upset, or we look happy or loving or caring, those things come through in our face, and the person we're with can hear those messages and see those messages as strongly as if we were speaking in words. We communicate in the way we touch each other. A gentle touch or a harsh touch, and that can be when you're actually embracing or being affectionate, but we also convey feelings in our touch when we help somebody. Let's say if we're helping a person transfer from a wheelchair to the bed or into a car, the kind of touch we use conveys a lot about how we're feeling. Our general body language, my favorite is, if you're watching television, when your partner's talking to you, that's body language that conveys an important message. Or if you're busy texting or you're busy reading the paper, our body language conveys a lot about how we're feeling. Of course, how we treat each other all day long, that is a way of communication. So in our general behavior, we're sending important messages to people around us. Even in email, when and it's getting shorter and shorter now with texting and tweeting, we've gotten it down from a conversation to 2 or 3 words, but we know how big, bold, capital letters in an email convey a feeling or a message. And we have to be careful about how we phrase things in emails because it's so easily misunderstood without facial expressions and physical gestures to explain what we mean. And I'm sure you can think of others, but the important thing is to remember that we're communicating all the time, even when we're not aware that we are.
So when, go ahead, I'm sorry.
No, I've got to back up. Sorry.
Yeah.
So when we think about the ways we want to communicate with one another and what are the effective ways to do that, I think that there are some key points to remember. When we're trying to communicate, the challenge is to do it in a way that we convey our ideas and our feelings and our needs. Keeping them inside, keeping them under wraps is not going to get the communication going. So we need to think about how we communicate so that the person we're trying to communicate with gets an understanding of what we're thinking or feeling and what our needs are. We need to communicate in ways that respect the ideas and the feelings and the needs of the other person. We can't talk so fast and so much that we don't let the other person think and respond. And I want to mention something that Pat had brought up before about how cognitive changes can interfere with connection and closeness. So if a person who has MS is experiencing some cognitive changes that slow their ability to process information, and their support partner is talking fast, isn't allowing time for the partner with MS to hear what's being said, process the information, think about how to respond, the conversation goes on without the person with MS actually being able to participate. Person with MS may be 2 paragraphs back trying to think about how to respond to a point that was made while his or her partner is already on to another subject. That kind of disconnect interferes with close communication. We want to make sure when we communicate that we send clear, unambiguous messages. Sometimes, without meaning to, we send double messages. We say one thing with our mouths while we're conveying a very different feeling or attitude with our body language. So we need to be mindful when we're trying to communicate that we are accurately conveying our feelings, that we're making sure that we're allowing time and space for the other person to express ideas and feelings and needs back, and be open to hearing what the other person has to say, and to sending that clear message that invites rather than discourages our response. So, Pat, when people are trying to talk to their healthcare providers about some of these issues, what are the most important things they need to keep in mind then?
Well, I think you've already elaborated the point that, it's sort of a topic that maybe doesn't get brought up, and it doesn't get brought up by the provider often, and it also doesn't get brought up by the patient. And so that's the place to begin, because you all are people who interface with your healthcare team. And I'll start off by talking about your main provider, and whether that's your family practice provider or whether that's your neurology provider. It doesn't really matter so much. It's the person with whom you are most comfortable. And I think when you're going to have this conversation, you need to sort of practice it, as it were, at home. And you want to be clear about what is it that you want to ask. And just come out with the words that feel easiest to you. You don't have to be a medical person and know all the fancy words. You just need to say, I'm having problems with, and then just sort of lay it out. So be clear in your mind what you want to ask. And I always recommend, no matter what questions you're asking, that you write it down before your appointment. I know my husband today had an appointment with his physician, and I made him laboriously write everything out before he went. And thank goodness I did, because he just gets so nervous when he's in there and he forgets everything. Well, this is a topic that makes people a little anxious anyway. And so to have things written down just makes it easier. Things don't slip by so quickly. And so have that all written down before the appointment. If you ask a question and your questions are not answered to your satisfaction or not answered at all, be persistent and ask who else you might speak with. And there may be someone else in that practice. There may be someone else outside of the practice that the provider might recommend. Also, you can use anyone on your healthcare team to be that sounding board. If you're seeing a physical therapist, you know how long you spend with your physical therapist when you see them. That might be, and that relationship might be the right relationship to ask the question. Now, they may not have the answer, but at least you can talk about it with them, and then they can make recommendations as to who you do need to go to ask those questions. So it's a topic to just bring out into the open and begin to ask those questions so you can begin to get the answers that you need. So Roz,
let me just add one thing to that. Sometimes people don't even know what questions to ask or how to frame them. And
True.
So I would also recommend that you can email or call an MS navigator at the National MS Society. These are all trained social workers who have a lot of experience talking with people affected by MS on all kinds of topics. And so you can call 1-800-344-4867 and speak to a navigator. Or you can email the society, and somebody will walk you through a conversation to help you figure out what questions to ask and how to frame them. So then you could write down that list that Pat's talking about that's so important, but you've had a chance to talk through the questions with somebody before you write them down, and then you can go to your healthcare provider with that list all prepared in whatever language you feel comfortable expressing it. So,
and those pamphlets that we mentioned earlier that are available through the National MS Society also talk about things in very clear language. And you may see something written in there and you think, that's exactly what I want to ask about. So have those on hand so you can read about the issues that you might be experiencing, and that will give you some confidence to be able to ask those questions. So Roz, do you have any final thoughts on the importance of intimacy?
Well, absolutely. You know, I think that, as you said at the beginning, it really is the glue that holds relationships together. And again, you know, we've talked in the last few minutes about sexuality and physical intimacy, but I want to remind everybody that there's intimacy in all of your different relationships with friends and family members, lovers and loved ones. And so to think about how important that is, and if you've noticed that there are changes or you're feeling more distant from the people that are important in your life, to think about whether any of the things we've talked about tonight might give you hints as to what those changes might be caused by and how you might begin to talk about them. And so, of course, communication is the basis for all of this, because until you start those important conversations, it's going to be difficult to address whatever the challenges might be. So for all of these important people in your life, remember that you want to talk about whatever your shared goals and priorities are. And if MS has changed those goals or shifted some of those priorities, the starting point is to communicate that with your partner or other important people in your life so that you can share your feelings about how those things have changed, what the implications of those changes are, and how you want to move your lives forward with whatever shifts have occurred. If you have shared activities that are being changed or altered or threatened by the changes caused by MS, these are the kinds of things you need to talk about, because there are generally workarounds, tools, and strategies that you can use to preserve those shared activities. And if the particular activities are impossible for whatever reason, whether it's certain kinds of sexual activities or downhill skiing or trekking through the mountains, if some of those things become impossible, it's important to work together and with your rehabilitation professionals and your healthcare team to figure out how to maintain shared activities that you both enjoy, because shared activities are so important to maintaining that closeness and intimacy we've been talking about. Pat mentioned before that healthy, intimate relationships are balanced partnerships in which each person both gives and receives. It's essential for every one of us that we feel like we're on both the giving end and the receiving end of a relationship. Otherwise, we feel like we're missing out. We're not contributing enough. We're not getting enough. So being able to talk to each other about what you each need and what you each want, so that you can think about how you can nurture each other, care for each other, support each other in a balanced partnership. Demonstrations of affection are important, not just sexual function, but again, the way we look at each other, touch each other, the way we behave with one another. Those are all ways that we can demonstrate affection. And if some of that has to change or be done differently than it did before, that doesn't mean it goes away. It just means that you talk about how we can make those changes while still making sure that the other person knows the affection that we're feeling. And sexual intimacy is obviously a part of this. And I have to urge you again not to let this important part of your life change or fade away because you're concerned about trying to talk about it. Taking the first steps, bringing up the conversation with each other and with your healthcare provider is that essential step to keeping this a part of your life. And so I just want to show you now those resources that Pat was talking about. There's the 800 number for the Society and the email that will connect you with an MS Navigator, and I can promise you there is really nothing that you can't bring up with one of these navigators. They will direct you to helpful resources and also help you frame your thoughts and your questions if that's useful to you. And these two booklets you can request from an MS Navigator in hard copy and they will mail them to you, or you can download them from the website with these URLs. And so I think with that, we're ready to take any and all questions.
Thank you so much, Roz and Pat, for all of that helpful information about how we can communicate with our support partners and foster these relationships. We didn't get too many questions in. We actually just got one. So if you do have a question, please feel free to chat them in the next few minutes, and then we can direct them to Pat and Roz. So this person's question is, I have problems talking to my wife. We are currently separated and she has MS. And she always turns the talk and the discussion about her and won't listen to me. I wrote her a letter and let her know how I felt, and I haven't heard from her in 2 days. I'm also going to counseling for myself, but my wife won't join me. What do you think my next steps should be in trying to re-engage my wife?
Pat, I think I'll start on that one.
I think it'd be good, yeah.
So this is a great question, and I'm sure something that's very difficult for you to deal with. And sometimes it takes patience and waiting. I think you have taken some very important first steps. Getting the counseling for yourself is important. Sometimes our partners don't feel ready to join in counseling or don't feel that it will be helpful. But my experience over the years has been that if one person goes to counseling and gets some help with that and makes some changes, that the whole family system can change around that, that the changes that you're making for yourself will impact your relationship with your wife. I'm sorry to hear that you're separated. That makes the communication more difficult, but I think by sitting down and writing the letter and sharing your feelings and ideas, that's a very important first step. And if she doesn't respond, I think you can follow up with another letter and another and another. But I think the important message is to say, it really hurts my feelings when you don't respond, and I'm hoping you'll think it over and at least respond to my letter, even if you don't feel ready to talk. Beyond that, I don't think you can force somebody to communicate, but by continuing to communicate yourself, you're doing the best you can to encourage her to respond. I think the other part of what you said makes me wonder if your wife may in fact be quite depressed herself. Sometimes when people are depressed, it's very hard for them to focus outside themselves. They get kind of locked in and preoccupied with their own distress or their own pain. I have no idea if that's what's happening with your wife, but sometimes that is what happens, and it makes it hard for the person to relate to their partner's feelings or concerns or issues. So if that's a possibility, she may need to get some help for herself eventually when she feels ready to do that. So there are no magic answers here, and you've taken the very important first steps to addressing that problem.
Thank you, Roz.
Thank you for sharing the question with us.
Yeah. We did have actually 3 questions come in on the same topic, and I'm not sure if you all will have the answers, but maybe for Pat, this can be one for you. ED drugs do not work well for me. Is there another type of treatment that could possibly work? I've never had this problem until I had MS.
Well, it's an excellent question, and I can hear some frustration in your voice, and I can totally understand. There are other methods that can be used. However, I mentioned it before, and I'll say it again, all causes of ED are not necessarily related to MS, and so the first step would be to talk with either the provider that you see now or perhaps a referral to a urologist, a physician who deals in issues with the bladder, issues of erectile dysfunction, and let him or her do the evaluation and some testing that may be needed to make sure that this isn't perhaps a vascular problem or diabetes or some other cause for erectile dysfunction. But yes, there are other methods that can be used if in fact this is something related to MS. So I think your first step is to ask the question of your provider and then get the right evaluation and find out exactly what the problem is.
But and I think also there are several other options besides pills. And so with that evaluation, the urologist can then fill you in on what the other options are and help you determine which one would be most likely to be successful for you. But you certainly don't have to stop with the pills. There are injectable options that work very well, but it's just important to get all the information from the urologist.
Great, and we actually had another question come in regarding bladder and possibly referral to a urologist. But this person's question is, I had bladder control issues, and that can be very embarrassing. This affects my mental mindset when wanting to be intimate. Do you have any recommendations?
Okay. Roz, I think I'll go ahead and take this one.
Sure.
This is certainly not an uncommon problem. So at least know that you have company with this issue. I think what most people find the most helpful is to make sure that you can do some behavioral things. If you're talking about losing urine during making love, I think that's what this question is about. And you can do some behavioral things like holding your fluids prior to, if you know that you're going to be doing this, that you want to hold your fluids, and that helps to keep less fluid in the bladder. And you can certainly try to empty your bladder immediately before. And that way, to the best of your ability, you have tried to get rid of as much of that urine as is possible. I don't know, obviously, what the bladder does the rest of the time, during the day, during the night, how frequently you're going, whether you empty your bladder well. If this is a bladder that is not emptying well and you kind of always are carrying around a level of urine in the bladder, that's a little different. That's a little not as easy as just emptying your bladder before you make love. And that would need some evaluation to see if that is the case, how much is there, and there might be some ways to manage that as well. So you need to ask that question, though, and look into it and see, because the bladder is, of course, this is an issue for sexual intimacy, but this is an issue in life. And if the bladder is not working well, and if there's a lot of frequency and urgency and leakage, it's going to get in the way of a lot of your lifetime activities and the quality of your life. And so this needs to be looked into, and in looking into it, hopefully be able to take care of the problem of leakage with sexual intimacy as well.
Great. Thanks, Pat, for that. And I think we do have time for one last question. This woman asks, is there a way to figure out if the lesions in my brain or that she has in her brain are directly affecting her sexual drive?
Roz, do you feel comfortable with that?
I think the general answer to the question is no. I think we can never tell exactly what lesions in the brain are affecting, because the correlation between lesions and symptoms is just not that clear cut. But I think the list of changes that Pat described at the beginning, changes in arousal, changes in ability to reach orgasm, vaginal lubrication, some of those are ones that we know can be affected by lesions in the central nervous system. They're common results of changes in the central nervous system. That being said, arousal is a pretty tricky issue. Right? We all know in our everyday lives that lots of things, tension, anxiety, irritability, something that goes wrong during the day, all kinds of things can affect how we feel and whether we feel sexual or interested or aroused. And so it's going to be very hard for anybody to give you a cut and dried answer about whether all of the issues are related to lesions or whether they might be related to other things that are going on. Pat, do you think I got that right?
I think you answered it well. I think all of us kind of want to see, I know patients have asked me for years, can you show me exactly which lesion is causing which problem? And I think we all want to know that. Unfortunately, there are a few areas of the brain where we can say, yes, lesions that occur there cause this symptom. But that's really the exception and not the rule. And so I think Roz's answer is correct. Plus, it often is multifactorial. So it isn't just that there's a lesion causing the problem, but as she stated, there are other issues going on in your life that can be adding to that. And so it all comes out to be, just not working well. So it's hard to know. But you can begin to tease out what is going on in your life and what issues are getting in the way of your quality of life. And is there something you can tease out and figure out for yourself? Is there a 2-year-old outside the door who's making it impossible for you to really concentrate on what you're doing? Do you have guests in the house? Are you really tired? I mean, there's so many things that can interfere, and none of those have to do with a lesion.
One other thing that we didn't really talk about, but I think affects all of these issues is that, according to the ads on TV, sexuality is supposed to be this wonderful, spontaneous, overwhelming, romantic feeling that comes over us and takes over, and we forget everything else. Well, life being what it is and MS being what it is, sometimes that spontaneity has to be replaced by a little more planning. So, if fatigue is getting in the way, it may be that you have to pick a little more carefully what time of day you decide that you want to be romantic. You may have to plan for morning hours when you have more energy. If bladder issues are a problem and you have to make sure that you haven't had a lot to drink, that may mean that you have to plan a little bit for that sexual activity and not just think you can do it at the drop of a hat. So sometimes arranging your medications so that you can talk with your doctor about whether you can adjust a medication that may be causing a problem so that you're more comfortable or so your spasticity or stiffness is more controlled. So I think being willing to do a little planning and plotting may go a long way to help you manage some of the issues that we've talked about tonight.
Excellent. Thank you. Thank you both. We actually got some comments back from the people that have been asking the questions, thanking you for your honesty and for all of the excellent answers that you've been providing for our participants this evening. So that brings us to the end of our webinar. And Pat and Roz, I just want to thank you again so much for sharing with us your expertise on intimacy and relationships. It's not a very concrete subject, so I know it's hard for all of us to try and grasp, but this was definitely helpful for everyone. And I want to thank everyone for joining us live tonight for this webinar. We did get some questions about how they can receive copies of this program, and you will receive a PDF of all of the slides from tonight's program, so you'll be able to access those resources that Roz had discussed about the MS Navigators. Before I share our March webinar topic, I did want to talk about some additional resources that Can Do MS provides to people living with MS and their support partners. You can access these resources on our website at www.mscando.org. We do have our e-news archive, which is our monthly e-news article. It's online, and it features all of Can Do MS's upcoming events and programs. And we also have an Ask the Can Do Team online portal. This is kind of a Q&A portal where you can submit your questions to us online, and one of our program consultants will get back to you and reply to your questions. So if you had any questions from tonight's webinar, feel free to submit them again online on our website. We also have a library of articles on specific topics in health and wellness, and you can find those articles in our Can Do library on our website, and they're all written by our programs consultants. So our next month's webinar is going to be on March 11th, the second Tuesday of the month, same time at 8 p.m. Eastern Time. And the topic is on exercise. It's Get Fit, Stay Fit, and Exercise with Your MS. So this should be a lively discussion with some great tips and tools on how you can stay active with your MS. And it will be presented by our exercise physiologist, Alex Ng, and physical therapist Tammy Roars. So again, feel free to go to our website, register for the webinar, and we hope to see you guys soon on our next webinar. So, and again, Pat and Roz, thank you so much for your help and for all of your expertise and input tonight, and I hope everyone has a great evening.